Welcome. And I would like to thank Dr. Frederick Mitchell
Hi, Patricia.
for coming today. We're going to discuss dentistry and dental care. And not only do I have Dr. Mitchell, but I have an extra guest. Dr. Mitchell brought another guest. Who is that guest, Dr. Mitchell?
We call him Cool Tooth. His friends call him Cool. And on it we can demonstrate the extent of fillings, the importance of gum and bone support of the root of the tooth. And many people don't know how they're diagnosed. What is a cavity? On this model here, a cavity exists only on the top surface of the tooth. Sometimes the cavity is bigger, and it will involve two surfaces. You hear the dentist talk about two surface, three surface filling. Here's the third surface in the back. And any more decay than that would probably necessitate a crown, because you can only divide up the tooth so many times before it's weakened. So that's how we come about in what fillings are needed.
And there's a separate price for each filling.
Yes.
For each surface.
The more complex it is, the more expense involved.
Dr. Mitchell, I'd like to ask you about, before you ever get to that, what causes tooth decay? What is some of the things that causes tooth decay?
It's a good question. Everybody has some amount of bacteria in their mouth. We're urged to brush, to gargle, to floss, to eliminate the food which furnishes nutrients to that bacteria. If they are healthy and multiply and overcome the teeth and the gums, you will suffer. The bacteria eat debris left in the mouth and excrete, just like animals. Little bacteria are little animals. Their excretion product is what is laid on the enamel, and it's very acidic, and it can eat through the enamel and cause a cavity. It can also threaten the gums. The roots of the teeth should be covered all the way up to the crown with healthy gums. The gums protect the root and the bone. If the gums recede, the bone is threatened. If the bone is eroded, the tooth will loosen up. So not only can you be victimized by cavities, you can be victimized by bone loss, and that's prevented if you have frequent dental appointments, frequent cleanings, and good home hygiene.
I have a friend my colleague, who just told me he went to a dentist and he smoked cigarettes. And tell me something about cigarette smoking and how it affects your teeth.
Well, you know, it's an insult to the tissue in the mouth, hot, acrid smoke. If you smoke meat in a smokehouse, it becomes stiff and brittle. And if you're doing that to live tissue in your mouth, that can threaten the saliva glands, which keeps the mouth lubricated, and it can affect the bone density and the gums. So smoking is not good. If you ever breathe the smoke, you know how nauseous that was to your lungs and your innards. The same thing occurs to your gums. They react to it, and it's not a healthy reaction. So yes, smoking can threaten your oral structures.
I remember when we were in high school, my best friend and I had another friend who had something called pyorrhea. What is pyorrhea?
Okay, it's like gingivitis is the mildest form that can threaten the gums, and it is shown by puffy gums and irritation, bleeding. There are a list of symptoms that can describe or diagnose gingivitis. If it goes beyond that and eats away at the gum and terribly reduces the bone that anchors the tooth, the teeth will loosen up. So you're not worried about dental decay anymore. You're worried about the tooth loosening up in your jawbone. And that's the point at which they can fall out. And the layman's term for it is pyorrhea. The dentist calls it advanced periodontosis.
Wow. I used to tell my daughter about King Tut. And that's before we found out the cause of his death. And I said that he died of bad teeth. And I see that he has buck teeth, but I found out it was hereditary. What would you do to prevent a child from having teeth that protrude?
Okay, general dentists go to school for 4 years to get their dental degree. And that degree allows you to practice general dentistry, procedures which you're comfortable with after 4 years of training. There are other graduates who wanted to specialize more. They're the ones who would become the orthodontists, the periodontists, the oral surgeons. There's several. Prosthodontists is another specialty. When we graduate, there's some of our classmates who remain 3 more years just in order to specialize in one phase of dentistry. So a dentist can't answer all the questions about, protruding teeth. The real answer would come from the doctor who specializes in orthodontics.
So, a dentist is a specialist.
Yeah, there's one elderly dentist who used to describe himself as a dentist. You know, he didn't like that general dentists are not considered specialists. We didn't go to the 3 more years of schooling, but any oral surgeon you go to would direct you back to the general dentist to do a filling or to make a denture, since their specialty is reconstructing the mouth or tissues or third molar extractions. He does primarily that. He had the same training we had to do general dentistry, but he no longer is active in that. He's doing procedures so complicated that he has to concentrate on that only, and usually he's not busy making dentures or doing fillings.
Dr. Frederick Mitchell, I would like to know something about your background. What made you become a dentist? Okay.
Okay, my best friend in college, and I've seen him for a long time, he's probably inundated with work and probably slowing down, getting ready for retirement. But he was a physician, and I kept thinking, whoa, he's going to be Dr. Lloyd Bonner. The doctor started appealing to me at that time. So I wanted to be Dr. Fred Mitchell, but I didn't want to be responsible for life and death. He'd have to get up in the middle of the night, run to the hospital, see about his patient, and still lose his patient. We don't want to lose any patients, and we want to save teeth. So my focus, and I was comfortable with that, is saving teeth. And I love gardening, and I raise flowers and vegetables, and sometimes I consider constructing dentures or a bridge as little flowers that I'm taking care of in the mouth. So just like you make your grounds beautiful, I like to make a person smile beautiful.
How do you perceive the role of a dentist in today's society? Do people think of it differently as, well, in the past, I understand that not until World War II did people start brushing their teeth regularly, and that's because the soldiers were ordered to brush regularly.
Okay. The way people view dentistry has improved. In school, and sometimes it was, a little unnerving. We're in the same classes the first 2 years of dental school as the medical students. All of us are going to be in that same environment for 4 years, but the first 2 years we're taking similar courses. We're also introduced to dentistry, to mannequins and studying tooth structure. But it's like we're to understand to some extent what's occurring medically, and I guess vice versa. We're hoping that the physicians, knowing that we attended some of the same classes together, will give us some credibility about taking care of problems related to teeth. So I think we're viewed almost comparably to physicians, and our field is another specialty in the health field.
We talked about the seriousness of what could happen if you don't take care of your teeth. And going back to the King Tut part, what I told you about, there was a theory that he died of bad teeth. How seriously can the lack of proper dental care affect your body?
You have to be careful with that, because sometimes people might view it as just frightening people into undergoing dental procedures by saying it could threaten your life. But if you view how the teeth are connected to your body, they're in a void down in your bone. So it's another joint. Just like you have a elbow joint and wrist joint, the connection between the tooth and the jawbone is a joint also. And just like there are nerves that travel, the elbow, there are nerves that travel from the jawbone to the tooth. There are blood vessels that are involved down there. And it's there's like 32 of them if you have all of your teeth. So it's not an open wound, but it's a wound that's very susceptible to bacterial infection. And if you aren't meticulous in keeping that area clean, those blood vessels will convey that disease and that infection throughout the rest of your body. And our concerns are now with the heart, people getting the implants. All of it could be threatened by poor oral hygiene, where bacteria reproduce mercilessly and travel down into the gums, through the bone, and to the rest of your body. So it is possible to lose your teeth or affect other parts of your body because of loss of teeth.
I know where you work in particularly that they give you a little dental care kit when you leave after you have a procedure, after you have your teeth cleaned. Oh, how regularly should we have our teeth cleaned? How regularly should we go to the dentist?
Okay, the tooth cleaning is important to keep a firm anchorage on the teeth. The gum and the bone are like anchors to the teeth. If they're threatened, the tooth will loosen up. What you're cleaning away is the buildup of tartar. That's the hardened substance on your teeth. Plaque is the softer one that some people can scratch off with their nails and see it. But if that resides long enough on the teeth, it turns into tartar. And all of these substances are noxious to the health. It's like the gums want to retreat away from that dirt and debris. That's how I describe it to people. It's like it's a dump, and for them to survive, they will retreat and diminish, and we call that bone loss and receding gums. They can't stand the dirt and filth on their teeth, and they don't want to be in that environment, so they just wither away to escape it. And bacteria are something else. If you don't keep control, if you don't brush, if you don't floss, it will overcome healthy teeth, gums, and bone. So some people are okay with the 6-month cleaning. Others realize that they need it more often. There are others who got to get a cleaning every 3 months. Bacteria and tartar build up on their teeth too much, and that buildup can threaten the health of the gums and the bone and loosen up the tooth. So it varies. Some people don't go for years. This is amazing to me. You ask them when last they've been to the dentist, and they'll say 4 or 5 years ago, and then you look in their mouth and you're almost shocked. It's clean as a whistle. None of the teeth are threatened. And I say those are people who did not need a dentist. And some people attribute the susceptibility to gum disease to genetics, saying if your parents had the gene for bad teeth and bad gums, yours might be threatened too. My father lost all of his teeth. I think my mom wears a full denture on top and partial denture on the bottom, but I'll never lose my teeth. So whether it's genetic or not, you can fight it by more meticulous and deliberate cleaning of your teeth.
Very good. How is it, should you brush your teeth in the morning? How many times a day should you brush your teeth? What can we do to save our teeth, to make sure that they last as long as we can? And you said we should have 32 teeth. I know there's something about those back teeth that go fast for everyone. You know, like you end up having those wisdom teeth taken out. Could you tell us about something about that, doctor?
Yes. I don't know how I arrived at this. I studied biology in college, and we studied, you know, the origin of species and evolution. And today, third molars aren't absolutely necessary in your dentition. Some people are born without the third molars. They only have one or only two on top. Some have none at all. And my analogy is that as cavemen, we had a very protruded jaw. That means there was a whole lot of room for teeth. And we used to chew wild berries, semi-raw meat, and that necessitated a whole lot of teeth. As evolution went on, food was more refined, more cooked. They started raising grain instead of eating wild berries, so they didn't need all those molars to do all that chewing. So through the selection of the species, a smaller jaw was more reasonable, and the population didn't need all of those teeth. So today, there's not enough room in people's jaws for that wisdom tooth, and it grows crooked, sideways, sometimes never comes to the surface, and it can hurt because it's still forcing itself onto existing teeth and can create real chaos there. Patients come in with maybe sometimes the front teeth being out of line because of the pressure of those impacted molars bearing down under the gum on the teeth in front of it, and it can start pushing other teeth out of alignment. So third molars is like a curse now, because some oral surgeons will remove third molars even before they give a problem, since they know it's not necessary to have third molars anymore.
Dr. Mitchell, what is the earliest time a child should go to the dentist?
Okay, the American Dental Association says age 2 is when a child should be introduced to a dentist. At that point, he probably has all of his baby teeth, and what we really want to do is acquaint him with coming to the dentist, to sit in the chair. It's a frightening experience, and sometimes the parents have to prep them for that. I had one child where he saw his older brothers and sisters get their teeth clean, and he wasn't old enough yet, and he started crying and bawling that he couldn't get into the chair too. That's the first time I've seen a child cry because he wasn't put in the dental chair. Usually they're crying when they are put in the dental chair. So age 2 is the age that we want, and not primarily to do, you know, real involved procedures, but more so to clean his teeth and acquaint him with going to the dentist regularly.
Could you tell us about the proper way of brushing? How long should we brush? How many times a day should we brush?
I carry my toothbrush with me all the time. And I think in addition...
Sorry, that was all good. Okay.
I'm prepared. In addition to, you know, whatever dental procedure a person needs, I think it's poor if you didn't go over how to properly brush your teeth, because you could be doing the most magnificent work. If the patient is going home and not cleansing their mouth, all of your good work is going to go for naught. So the proper way to brush, we say, is a way that will exude all of the material that's stuck up in the gums out. That means the brush under pressure, that you can actually see the bristles bend that means you're placing enough pressure on it to squeeze out whatever's under the gums. So we say brush gums and teeth. And some people can go like this. Others feel that's tedious going all the way around the mouth. So circles, that will accomplish the same thing. Hard, brisk circles, but with a soft toothbrush. Some people used to use a hard toothbrush and bear down and thinking the harder and more brutal they are, the cleaner their teeth will be. But we have learned that a hard bristled brush will actually put a groove in your tooth and wear away the enamel, and the tooth will become sensitive. So we say a soft bristled brush, gums and teeth, and it's not the vigor and harshness of the bristles, it's the frequency after every meal. If you eat a bag of corn chips, we say you should brush your teeth.
Oh, we only have a few minute or two, but I want you just to say something quickly about the importance of flossing, because my daddy was very, very, made sure that we flossed and we, did it correctly.
Yeah, I think everybody experiences food getting caught between your gums, and there's a peak in the gums, and it measures how healthy your gums are. And it's in between the teeth. And we say that area has to be kept clean or you will lose the gum that's in between your teeth. And if you lose the gums, it threatens a bone, the tooth loosens up. And some people, you can see them smile, and there's dark voids in between that area where there should be pretty tapered, tightly fitting gum. And that's the reason for flossing. It's one of the areas that can threaten the gums if it's not kept clean.
Dr. Mitchell, I want to thank you so much for being here. I might have to have you back again because there's so much to learn, and this is just another way of taking care of yourself.
I felt like I was with a patient. Yes, thank you so much, Patricia. And dentists, I think they used to do this back in the 50s and the 60s. We don't do this anymore. But for the interview, I want to do it saying it's probably the only time I'll get to give lollipops out. And one to the director. And after you eat that, in order to minimize the damage, you get a toothbrush, toothpaste, kit, and when you finish that lollipop, please brush.
Oh.
And this is for our director who so masterfully engineered this whole show, a kit for him to brush, and his own lollipop.
Thank you.
You're welcome.
Okay, Dr. Mitchell, I would like to thank you.
I thank you.
Joe Cool, I'd like to thank you so much for being here.
Yes. He was happy to be here.
We hope to see you again.
Great.
Thank you.
Very good.
Thank you very much.
I thank you. Good night.
Okay.